it's a symptomatic treatment that is effective during the treatment, and more long-lasting effect what we see after stopping the treatment after a few months. The patient is still symptom-free, thereby it's somewhat better than the conventional medical treatment. Rinolight treatment affects the immunity in the nasal mucosa. It inhibits the T cell activation by inducing apoptosis in T cell. This light treatment induces apoptosis in eosinophil cells, in epithelial cells, and it also blocks the histamine release from the activated mast cells. This mechanism of action is what we see clinically, that during light treatment there is a very nice improvement in the clinical symptoms of patients having hay fever.
People who have contraindications for specific immunity, for example. Some people, the allergy drugs don't work, or people who make everyday sport, this is a contraindication for specific immunity. Or pregnant women, you might not give them drugs because you don't know the influence of the unborn child. So this would be an alternative to perform endonasal phototherapy.
A betegek döntő többségénél már az első 3-4-5 kezelést követően jelentősen javulnak a tünetek. Van, aki néhány kezeléstől már sokkal jobban van akinek 6-8 kezelésre szüksége van ahhoz, hogy elmúljanak vagy csökkenjenek a tünetei. A Rinolight kezelésnek egyetlen mellékhatását tapasztaltuk, ez az orrszáradás, amely viszont A-vitaminolajjal rendkívül jól kezelhető, menedzselhető, de tulajdonképpen ez a mellékhatás a betegek számára egy minimális kellemetlenséget okoz, és körülbelül a kezelt betegek 10%-ánál fordult elő ez idáig.
There are some safety studies by the Hungarian study group who investigate the safety, and they had really good results.
We could show and published in 2005 in the Journal of Allergy and Clinical Immunology that treatment with Rinolight is highly effective for the patient having allergic rhinitis compared to the placebo treatment. And in the last few years, many other groups from Germany, Turkey could also show the efficacy of this treatment for patients having hay fever.
We make real placebo-controlled randomized trials and controlled the treatment group versus the placebo group, and we had significant improvement in the so-called total nasal symptom score, nasal obstruction, in nasal itching, in sneezing, and in rhinorrhea. There are some serious risks regarding the subcutaneous specific immunotherapy. First, I heard about Rinolight when I was reading an allergy scientific journal, and I thought, whoa, this sounds to be an interesting therapy tool. And so I began to research to get more knowledge about it. And then I got in touch with the company just to try it, and we did perform a trial in Germany, a study on patients, and surprisingly we had good results.